We are very happy to have you here, Priya. I would keep her introduction at the end because I want Priya to talk more. I usually skip it out only one or two, so I want Priya to introduce her. Over to you, Priya.
Thank you so much, Sharmi, for giving me an opportunity to do this part because it's been my passion to promote preventive healthcare and especially when it comes to dentistry. And I've been doing it with a lot of children and women's group. I'm glad that I met you and I've had an opportunity to do that. I would like to present my screen. I would like to start with a small presentation. Uh, Please let me know if you can see my screen. If there's any disturbance, please let me know. Can you see my screen?
Yes.
Thank you. So, dear ladies, um, today, as Shami mentioned, I'm going to talk about menopause. Menopause is a natural and an inevitable stage in a woman's life, and it is marked by a lot of hormonal changes. While there are many physical and emotional impacts of women, and it is widely discussed. The one thing which is usually not discussed during this phase is the connection between menopause and the oral health. And it is a very crucial thing to actually be discussed. And I'm glad that I have been given an opportunity to talk about this. During my talk, I think so, I will be able to give you some insights and also some strategies for maintaining optimal oral health during this pivotal life transitions. It's always said that some pains are physical, some pains are mental,
Yeah.
but the pain which is more physical and mental is dental. So I
Oh,
feel post this talk you will definitely
you're scaring
take care of
us.
post this talk you'll definitely take care of your oral health, and you don't have to be uh, put under any undue pain
I think
so
we
that
should add economical.
I will talk about that also during. So I'm just going to talk about what is menopause, the oral health changes, the dental problems during the menopause, the treatment modalities available, and definitely about maintaining a good oral health. So there are many phases of menopause, right? So it marks the cessation of the menstruation for 12 consecutive months, right? So we have this perimenopause, we have the premenopause, and we have the menopause. So in premenopause, there are not too much of noticeable changes, but we have seen a lot of changes happening during the pre-menopause, and now the age of menopause is also hastening. We are seeing a lot of younger crowd attaining menopause quite early due to our lifestyles and food habits. It starts with a slight uh, signs of weight gain, mood swings. Then, by usually we see that by age, average age which is seen is more than 50 is the menopausal stage. So what happens during? We have the common symptoms like, right, the hot flushes, the night sweats, the mood swings, sleep issues, overweight, and cravings. All these things happens, but there is some certain change which is happening inside the body which we don't have a control on, right? As the women approaches menopause, her body's production of hormone estrogen gradually decreases. This hormonal shift can have a significant impact on her general health and also on the oral cavity. And this in turn leads to a lot of challenges. The level of progesterone, which is another reproductive hormone, also starts to fluctuate and also contributes to a lot of these oral health issues. With these two hormonal fluctuations happening, what happens? The oral hemostasis or the oral environment also slightly gets disturbed, right? And when this gets disturbed, there is definitely a potentially increased risk of oral health uh, problems in women. And studies have shown that more than 70% of women experience these oral symptoms during the menopausal phases. And and it is a stigma that people don't come out and talk about it. And survey has showed that only 2% have discussed about their concern with a dentist. Not many people open up till we ask a question, and 84% are not even aware that this will definitely impact a woman and her oral health. And 79% of them, they have noticed some changes happening in their gums, teeth. Then when they have adequate awareness, they plan to make a visit to the dentist and discuss about the link of menopause and the oral health. As I already said, there are a lot of things happening with weight gain, mood swings, hot flushes. The oral health changes also happens. We have dry mouth, we have bleeding gums, burning mouth, bone loss, and a lot of gum diseases, tooth decay happening. There are women coming and telling me, my I didn't have a single cavity till I was 50. Suddenly, there is an increased risk of cavities. So, let us see the common dental problems during menopause. The first common problem that usually the women approach us is the tooth sensitivity. Tooth sensitivity happens due to the physiological nature of the gums receding, the root portion of the tooth being exposed, and enamel wear due to the dentine and cementum being exposed. So, anything when you take in anything hot, cold, sweet, that tends to give a pain, the sensitiveness in the teeth, which lasts for some time and then it comes down. There are also some medical conditions like this acid reflexes, wherein
Yeah.
the acid, stomach acid is got onto the mouth,
Yeah.
also corrodes the enamel, and that also leads to tooth sensitivity. The second most common thing is dry mouth. People say the dry mouth condition is called as xerostomia. This is usually caused due to a decrease in the flow of saliva in the mouth. Saliva is very much important for, it is the first digestive hormone, digestive juice present in the mouth, and it is very important for digestion. So it all starts from the mouth, and when we see people complain their inability to swallow, eat foods, and even talk properly because of this dry mouth. We have seen dry mouth conditions more commonly in people who have undergone radiation for cancer of the head and neck regions. It's more commonly seen. Once there is dry mouth, again there is a risk for tooth decay, gum disease, bad breath, and also bacterial and viral infections in the mouth also increase. We have also seen a symptom called as burning mouth syndrome, wherein people suddenly, whatever they were eating normally, suddenly the food has started to give them a burning or a tingling sensation in their mouth, and they are unable to enjoy their favorite food because of the hormonal changes during menopause. What happens? There is the thinning of the skin in the overall body, the thinning of the epithelial layer, the first layer of the oral mucosa, also has an impact on causing this burning mouth syndrome. So there are also, people have also noticed some taste changes in their favorite foods due to this burning mouth syndrome. Usually, it's a combination of dry mouth and burning mouth, which we have seen in individuals. When there is decreased salivary flow, then there is an increased chance of getting tooth decay. So, a dry mouth combined with excessive sugary diet and improper oral hygiene is definitely a great combination to have tooth decay during menopause. Coming to the gum disease, yeah, this is something which everybody can notice. The first thing is the bleeding gums. The natural, the the natural color of the gums is coral pink in color. But as I said, the gum inflammation increases, and during menopause due to hormonal changes. So it leads to a periodontal disease. The first sign of the gum disease, which is known as gingivitis, is swelling of swelling of the gums, bleeding gums. The gums, in this case, it is also called as gingivostomatitis. The gums in this stage just bleeds when it is just touched. That is because of the altered hemostasis, which I told previously, and the exaggerated response by the body. Sometimes what happens, due to this gum inflammation, the body's immune system also weakens, so that it is unable to fight off harmful and disease causing bacteria which causes the gum disease. Now, I told you that gingivitis is the first phase of gum disease. If this gum disease is left untreated, then it goes to the next stage, and the assault is on the underlying bone, which is called as periodontitis. And once the untreated gum disease definitely has an increased risk of going into periodontitis, and that ultimately also leading to a tooth loss. So, tooth loss is definitely of a concern to anybody, because it has a lot of implications on your oral health as well as general health. So, it is very, very important to take care of your gum health so that it does not lead to tooth loss. Now, this is one thing. As you know, that during menopause, there is a decrease in bone density, which is happening throughout the body, all the bones. Now, this also happens in the jawbone. Jawbone is the foundation for holding on to your permanent teeth. A decrease in the density leads to loosening of the teeth and tooth loss. Not only that, if there is tooth loss, there is also change in the uh, oral structure. You suddenly feel some individuals are looking older than how they were a few years back, because the teeth, once the tooth is lost, the bone also starts to resorb at a faster pace, and it shrinks. When it shrinks, the height of our face also comes down. So it definitely has an impact on our uh, appearance.
Yeah.
Then osteoporosis. Some people, menopause is also as it is related to few individuals having severe osteoporosis. You should always be open with your dentist to say what medications you are taking for osteoporosis, so that any dental treatment which is done by the dentist, so that the medications does not hinder the healing process and the outcome of a dental treatment. Now let us see. Okay, I think so I have scared you enough. Let us see how we overcome. And there are a lot of treatment options available also.
Yeah.
See, the tooth sensitivity, yes, the first and foremost is using a fluoridated toothpaste and other desensitizing toothpaste which are available in the market, so that they act as a protective coating. There are certain bonding agents and varnishes which are available, which also prevents these tooth sensitivity. Sometimes, if there is too much of exposure of the root of the teeth, we do have the cosmetic procedures or the gum grafts to cover the exposed area to prevent the tooth sensitivity. As during the menopausal period, we have a lot of stress due to the hormonal fluctuations. People tend to clench their teeth, and this leads to enamel wearing away. So that can be definitely prevented by giving a mouth guard. So, yeah, this is one of the important phases where I was talking about gum disease, right? So, the initial gum disease can be prevented by doing a simple dental cleaning to improve your oral hygiene, right? So, dental cleaning removes the plaque and tartar deposits on the tooth and the gums, and thereby promoting the gum health. if it's a next phase, second phase of gum disease, there is something called as a scaling and root planing, where we go a little more deeper to remove the diseased tissue. There is also a pocket reduction therapy or a periodontal flap surgery, wherein a gum specialist or a periodontist opens up the gums to clean the tooth entirely and removes the diseased tissue and puts it back so that the gum starts to heal. Nowadays, I know I'm sounding a little
Very,
scary,
I know.
but nowadays we have such advanced treatment, especially with LANAC surgeries using of lasers, wherein the outcome is excellent with limited pain and discomfort to
Priya,
the
Priya, sorry to
patient.
interrupt. Please mention
Yeah.
the pricing also, the treatment pricing, so that we will.
I have not finished my slide. So when I come to my last slide, you will tell me.
No,
Yes, I agree with
that
you.
will motivate us to prevent it from going to
Definitely.
that
My
extent.
last slide will definitely motivate you to keep your oral health and prevent a lot of dental issues. So again, we have bone grafts. When there is lot of loss of too much of bone, we give bone grafts to, so as to stabilize the tooth. We have gum regeneration with tissue regeneration processes, and now we use the PRP also to so that there is a lot of regeneration happening from the patient's own tissue. But again, all this, your dentist is the best person to advise you on which stage and what is the treatment modality required. Now, I was talking about bone loss, I was talking about osteoporosis. If people are suffering from severe osteoporosis, then their chance of dental implants failure is really more. So, in order to prevent that, we have to tackle the underlying health issue, that is the osteoporosis, see which condition, how their jawbone density is, and then plan on doing dental implants. If it is slightly less, if it can be accommodated, we also do bone grafts and other therapies so as to build up the bone in the jaw, but all this depends on the general health of the individual. In extreme cases, there is a debate regarding the HRT hormone replacement therapy. It has shown a lot of benefit for certain individuals, and it has shown not shown great benefits to other individuals. So, definitely, this is something debatable, but this is not in my scope of
Yeah,
things
yeah.
of talking to.
We are
So,
doing a next
definitely,
session. We are doing a next session on this with
yeah.
Dr. Vikram.
So now, coming to maintaining, yes, definitely. For the gum health, having a vitamin C rich food helps in gum health. And in general, consuming a balanced nutrient rich diet supports your oral health, and which is also good for your overall health, and definitely reduces the mm, risk of diseases, especially with the oral diseases during this menopausal phase. And habits, yes, certain habits, quitting smoking, tobacco is seen to be one of the biggest agent causing oral cancers. So, quitting tobacco is very important during the menopausal phases, not only during menopausal phases, in all stages, because the oral mucosa or the skin of the mouth is very tender. It can't take the harmful effects of tobacco. Even if you see a small variation in any of the oral structures of the mouth, please report to your dentist. And when we see somebody in the initial stages, just by stopping or the cessation of the habit helps in curing the disease completely. Then, maintaining optimal oral hygiene is by brushing twice daily, rinsing the mouth thoroughly after whatever you eat or drink, and flossing. Yes, flossing. Yes, there are many oral aids now which helps in flossing. We also have the water flossers. It has worked amazingly for people who have gaps between the teeth. The use of motorized toothbrushes also help in maintaining optimal oral health, oral hygiene. But yes, visiting the dentist for your professional cleanings at least once in 6 months is a must, so that you are preventing any potential oral health problems which might occur. Yes, here, Sharmi, you were asking what are the charges? What are the charges? So people always
No, no,
feel
no, you don't
this
have to
is
scare us more. I just meant to say that it's going to be expensive. They should know that. The
yeah,
consequences sometimes be a negative motivation for us to
right,
not to
right.
ignore.
Right. People always feel dentistry is expensive, but at what stage are you
Yeah.
visiting your dentist? If it is a simple cleaning or a small filling, the amount of procedures done is definitely less than going in for an extensive treatment or tooth loss. You are definitely spending that amount of time and money because the procedure is also specialized. So it is up to the individual to know at what time they want to visit their dentist. I hope this answers your question. So that's it from me. If you have any questions, I may be able to take up a few questions, but if you have any